Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Rania Nassar, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters show, a show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. Today's topic for Public Health Matters is hip, knee, and shoulder replacements. We will be discussing when a joint replacement is needed, as well as best practices for healing after surgery. Joining us today is Dr. Raj Yalamanchili, Director of Joint Replacement at the University of Maryland Upper Chesapeake Health, and Christina Pedini, Assistant Vice President for Rehabilitation and Neuroscience at the University of Maryland Upper Chesapeake Health. Welcome to our show, and thank you both so much for being with me today.
Thank you.
Thank you for having us.
So to get started, do you mind if you can just take a little moment to introduce yourself and let me know what your connection is to the topic of hip, knee, and shoulder replacements?
Well, I'm Christina Pedini. I have been a physical therapist for almost 30 years now and worked with many patients that have had total hips, knees, and shoulders. And now I oversee the 3 outpatient programs and the inpatient side of rehabilitation, so the whole continuum.
Wow, great. Thank you. Dr. Raj?
My name is Raj Yalamanchili. I've been practicing here at Upper Chesapeake for 12 years.
Wow.
I'm a board-certified orthopedic surgeon. My specialty is hip and knee replacements. I'm fellowship trained in that. And I also work as a director of joint replacement at Upper Chesapeake.
That's awesome. Great. Thank you both. So let's get started with our first question. What is a joint replacement, and what does that process entail?
A joint replacement is when your native hip or knee joint wears out, and we put in an artificial joint replacement where we resurface the end of the thigh bone and the end of the leg bone. The process starts when you have hip or knee pain, and you go to the doctor and they will assess you, and if the arthritis is severe enough, and if the conservative treatments don't work, you are a candidate for joint replacement.
Interesting. And so what should someone do if they may have like a hip, a knee, or just shoulder pain?
I think the first step would be, take a medicine like ibuprofen or Aleve, rest it, ice it to see if that will get better. If that doesn't help, probably should see a doctor to get it checked out.
Okay. And then what would cause the need for a joint replacement?
So when a joint is completely worn out, either from just wear and tear, previous trauma, a congenital birth defect, or osteonecrosis where the bone dies off, and you're in severe pain and have trouble with your daily activities, that would be the case for a joint replacement.
That's interesting. How will then a doctor determine if like a joint replacement is needed?
So they would do studies in the office. We'll start off with an x-ray, and sometimes that's enough. If you have bone-on-bone arthritis on the x-ray, there's no further imaging needed. We would try conservative treatments first with medicines to calm inflammation down, alleviate pain. We'll do physical therapy to improve range of motion and their activity level. Sometimes we use braces or a cane to offload that leg, and we'll see what happens. If they get relief and they're able to function, the process stops there. We can also use injections sometimes to give temporary relief of pain. If the process, if all these things don't work, then you're a candidate for a joint replacement.
Is there a time period for that? Like for how long maybe, like if you're using a cane for how long and maybe that doesn't, is there a time period?
Sure, usually the evidence-based recommendation is to try for at least 3 months.
3 months, okay, that's good to know.
And we do have a collaborative approach that they often send patients to physical therapy to work, and oftentimes people do feel better, but sometimes people have come back a couple of times as the arthritis would get worse or they'd get older, and so then it gets to a point where the physical therapist communicates with the physician to say, we've tried, and you know, it needs something more. This is just not providing the relief that the patient is really looking for. So, yeah.
So if a joint replacement is not needed, how can someone manage their hip, knee, or shoulder pain?
So I'll answer the first part and then I'll punt it to Christina.
Okay.
Let's say you're in your 30s or 40s and you have hip or knee pain. Typically, when you're younger, we typically don't recommend a joint replacement. The reason
Makes
being
sense.
they wear out faster. You're going to need multiple surgeries down the line. And most of the time, that is managed conservatively. First step would be to maintain an ideal body weight.
Okay.
Let's say, for example, you're 10 pounds overweight, and let's say you're taking 2,000 steps a day. 10 multiplied by 2,000, that's 20,000 pounds extra on those hips or knees.
Okay.
So taking that much weight off, even though we haven't cured the arthritis, less pressure on the damaged knee or hip, there's going to be less pain. That's the first step. The other things are some, physical therapy is one of those things we touched on to strengthen the muscles around the joint. Injections, if the oral medicines are not helping, to give temporary relief. And we're trying to improve the quality of your life. We can't cure the arthritis without a joint replacement, but these are some steps to improve the quality of your life so you can enjoy life.
And some of the specific things that we do with physical therapy, it can be that it's more musculoskeletal, or the muscles are involved, and we can do manual therapy to help with the muscles that may be a little bit angry and get things aligned better. We try to get the flexibility better, and then try to get strengthening and determine an exercise routine that a patient can be on to help them feel better and do the functional activities that they want to do.
Yeah, I think being active, especially as soon as young as you possibly can, I think that's just extremely, extremely important, and would definitely help with a lot of the stuff that both of you mentioned.
Absolutely.
Yeah.
So what are then the different approaches to hip replacements, and what are the benefits to that?
Sure, I'll take that question. Hip replacement is when we replace the ball and socket in the body, and that can be done through primarily 3 different approaches. A posterior approach, a lateral or an anterolateral approach, and a true anterior approach.
Okay.
Studies have shown that 6 months out, all approaches, surgeries done through all these approaches do fine. There's not really a clinical difference. In the early post-op period, there's a slightly higher rate of dislocation with the posterior approach.
Okay.
Having said that, some people are not really a candidate for an anterior approach. If their BMI is high and they have essentially a roll of fat hanging over their hip in the front, we put an incision in that fold. That skin incision is at more risk for infection.
Okay.
So we have to move the incision to the side, either a lateral or a posterior approach. The other part of the hip replacement, the ball and socket could be made of different materials. It could be a ceramic on a polyethylene bearing. It could be a ceramic on ceramic bearing, a metal on metal bearing. And each one has its own drawbacks and advantages.
Okay. And then, are there any alternatives to a joint replacement?
If you go by the evidence, there's not really much we can do short of a joint replacement to cure arthritis.
Okay.
People are working with stem cells to regenerate cartilage, but there's no long-term studies saying that if you have bone-on-bone arthritis, and getting a stem cell injection is going to cure the arthritis and make you whole again.
So we definitely need more research for sure, though, just to
Sure.
continue. So what does a patient expect during and after surgery, and what is the best way to control that pain post-surgery?
I'll let Christina take that question.
Okay. So immediately after the surgery, the team has done a lot to help make sure that they are have as little pain as possible.
Yes.
And then we have a standard regime for pain, but it also can be customized to a patient because everyone is different. And the nursing team and the rehab team, when a patient wakes up from surgery, they are always in touch with them, making sure that they're comfortable. There's some pain that's going to be expected after surgery, though. It can really be relieved not only by the pain medications, but also by movement and ice. And I think those are some things that sometimes people think, oh, that's such a minor thing. But sometimes it's really, someone really gets very stiff after the surgery, and getting up, moving, it's very important. It's very important for the recovery. It really is one of the most important things. But ice too is another
so big.
another part of it, and it helps to decrease swelling as well. So those two things really, they seem like small things, but they really do make a big difference. So that's very important. And each person in the time frame right after surgery, we see what works for them, and then they're sent home with the appropriate medications, appropriate instructions, as well as the appropriate follow-up with therapy, whether it's at home or an outpatient. We try to get people moving as quickly as possible to get them back to a level of independence.
Great, that's awesome. So what are the general recovery times, and how long until the patient is back to the activities that they love?
It depends on the patient, and it depends on the type of surgery that they had, as well as what their baseline function was before the surgery. So we will start therapy right away, actually, within hours after surgery. And it's funny, having been a physical therapist as long as I have, patients used to stay in the hospital for a week, and they actually do so much better getting moving and getting out more quickly. And so it's been wonderful to see that difference. And we used to laugh about that a long time ago. But getting them moving as quickly as possible, like I said before, you can hear that that's something that I'm really a big fan of. But the total length of time, it depends on what they want to do. And some activities, like, long distance running isn't really a good thing to be doing after a joint replacement. But, walking around the community, doing those things, that can happen really within a week or two, depending on the patient. In the beginning, we often will give patients like a walker or a cane, but give them something in the beginning just to give them a little bit of support until they're fully healed and fully confident in moving. But most people start with a walker in the very beginning. But getting back to other activities can be within 4 to 8 weeks, really, that someone is back to a lot of activities. Some recommendations are that, like, if you played singles tennis prior to, you might want to do doubles afterwards to be able to have a little less stress on the joint. But really, a lot of people get back to things very quickly now. It's really pretty impressive.
That's great. I feel like that's actually really awesome to hear, because it can be really intimidating to have, I'm considering this a major surgery, but to have a surgery like this and you think, oh, well, I might not have time for the recovery. It might take months, or who knows how long it will take. But to hear that, that's amazing. And I think people really would appreciate that. And because if they have these issues, we want them to get the care that they need. And sometimes that post-op, it can be very intimidating for people. So that's really good information.
Yeah.
So then, how will a joint replacement then affect someone's quality of life? Can you live your life as normal after with the replacement?
Yeah, there are some precautions in the beginning, but really, people get back to a lot of very normal activities, and we promote things, again, like walking. I say it a lot because people sort of have a mindset, oh, I'm going through surgery, I have to I have to really protect myself, and and yes, you have to be cautious, decreasing your risk for infection and everything. There's things that we instruct patients on before surgery. We have a joint coordinator who helps walk everyone through exactly what they need to do before the surgery to help decrease their risk of infection and everything. Of course, you have to keep an eye on things and keep everything clean. And we have special dressings and everything as well after the surgery that that helps people to make sure, because risk of infection is a serious thing after surgery. But there's many things we know that work very well, and we do many things to help prevent that and do a really good job at that. So, but then, you know, really just getting back to those activities, it happens very quickly. And I think that is really the most important part about that. So,
Walking is the best medicine.
Absolutely, absolutely.
Who would be the best candidate for a joint replacement?
So somebody who's exhausted all the conservative treatment options for arthritis. Before I said somebody who's a little bit older, but I've done a replacement in somebody as young as 19 because their hip has been eaten away by avascular necrosis, and they're in a wheelchair. And their quality of life is terrible. So typically, somebody who has bone-on-bone arthritis, who's exhausted all the conservative options, and who wants to improve their quality of life. Now, a joint replacement is still an elective surgery. So even if you have bone-on-bone arthritis, let's say you're 85 years old and you have multiple medical issues and you're essentially homebound, then you may not want to take the risk of surgery. You may just want to, use a cane, take some pain medicine, and deal with that.
Okay, that's interesting.
We do find better outcomes with patients with lower BMIs. So if a patient deals with obesity, there are a lot of options now for people to manage that, which can be a really good thing to do prior to being a good candidate for a total joint replacement. So that is something we work on and recommend.
I completely agree. If your BMI number, BMI stands for body mass index, it's a function of your height and weight. If that number is over 40, your risk of complications after a hip or a knee replacement is higher. Your risk of complications with anesthesia is higher. So ideally speaking, we want to get that number below 40 before surgery. The ideal number is 25. You don't have to become ideal, but below 40 would be better for surgery. Same with diabetes. If you have diabetes, we want that to be managed properly and have your numbers, your A1C number below 7.5 before we do the surgery. If it's poorly controlled, you're at high risk for infection.
Okay. So then how long would a joint replacement generally last? So I know that a lot
I can
of
take
people
that
ask
question.
That.
So it depends. What we can say is knee replacements that were put in 20 years ago. If you look at the literature, 95% of them, there's a 95% survival rate. The materials we're using now are a little bit better, so hopefully they'll last longer. But from the data we have, we can say, maybe 20 to 25 years for a knee replacement. The other thing is activity level. If the replacement is in let's say a 40-year-old person or a 45-year-old, they're going to be more active than a 65-year-old person. So they may wear that out a little bit faster. Low impact activities like swimming, biking, walking, generally are recommended as opposed to high impact stuff like running or jumping when you have a hip or knee replacement. Can you run with a hip or knee replacement? Sure, but it's not going to last you as long.
That's a really good answer, because I think a lot of people might even think, well, I'm 40, I need a hip replacement, and let me just push it off. So it's kind of important. We just want to make sure that they're seeing the doctor and taking care of what they need to take care of. Is rehabilitation recommended prior to a joint replacement?
It is. We definitely see better outcomes when patients have gone through prehabilitation. It's hard word to say.
It is.
And it is. What we do is make sure that someone has the strength and flexibility maximized prior to going into the surgery. Also, knowing the exercises that they'll have to do after the surgery, it's muscle memory.
Yeah.
When a patient has already gone through it and done it and knows that, yes, okay, this is what I did. Now I have a little bit of pain after surgery, which will decrease, but it is a little difficult in the very beginning. But when we've seen that they've been very confident with them prior to surgery, they do better afterwards. Also, patients have a better cardiovascular strength going into the surgery, and that's very important. You can't have been sitting around and not doing much because you had pain from this arthritis that you had prior to the surgery and then expect to jump right up after surgery. So we also look at that as a component. What is someone's activity tolerance prior to the surgery? We can also teach any of the techniques for, like using a walker, or if you have stairs at home, how to do that, and review any equipment or things that you might need prior to surgery so you can be all set and ready after the surgery.
Okay, great. I think I know you mentioned flexibility in the beginning. I think that is probably the hardest maybe for a lot of people to work on, but definitely obviously very, very important. What type of rehabilitation or physical therapy will need to be done following a joint replacement?
So we start right away. Again, hours after surgery. We will even come into the like PACU, which is after surgery recovery. And many patients don't even stay overnight anymore in the hospital. So we make sure that they're doing well, able to walk, moving, and so we start right away, start some basic exercises. Then as we get to outpatient therapy, and sometimes there's a little bit of home therapy in between, but most of our patients are going right to outpatient therapy. We work on range of motion, we work on strengthening, we work on controlling that swelling that can happen, and a lot of that is education with the patient. I will plug ice and walking again, which seem like simple things, but can really make a big difference. Then we really work on range of motion, especially after you heal. And this is more for a knee replacement. A hip replacement doesn't need quite as much therapy as long as the strength and the walking pattern and everything looks good. Really the most important thing after hip replacement is that walking and moving and going on. So if we still see things later on that need a little bit of help, we can do that more so with a hip replacement a little later. With a knee, though, getting pretty aggressive with range of motion early, and I use aggressive in a relative term. We really want to make sure that range of motion, that we get that quickly. That can be a challenge. If people are like, oh, it hurts too much, whatever, you do have to stretch it. You do have to make sure it gets straight. You have to make sure you can bend. And the bend is really important for certain activities like going up and down stairs, getting up and down off of like lower chair, or there's different activities that you have to do. And if you don't have that range of motion, both getting your knee really straight as well as bending it, it will make functional activities difficult later on. So we really, really work on that. And pain control, another piece of the puzzle that we need to work on and help a patient through therapy afterwards.
And I'm sure it's also extremely important to continue to live that healthy lifestyle, eating healthy, not smoking, being active, getting outside. I think, again, that would contribute a lot to that post rehab.
Absolutely. Smoking actually puts you at more risk for complications after a hip or a knee replacement. Sometimes the bone doesn't grow onto the implant because of the nicotine. You're at more risk for wound complications. And the walking, not only is it helpful for swelling and strength and everything else, it puts you at less risk with DVT or deep vein thrombosis or a blood clot in your leg after any surgery. So you should be, getting up and moving once every hour or so while you're awake, after a hip or a knee.
Great. Are there any possible risks or complications that can come from a joint replacement surgery or a hip surgery, and how can one lower those risks?
Sure. So as with any surgery, there's the risk of infection, bleeding, blood clot. The chance of those things happening is less than 1 in 100. With the hip replacement, there's 2 unique complications. You can have a ball and socket dislocation. Usually that happens if the hip precautions are not followed perfectly for the first 6 weeks.
Okay.
And that's something that's gone over in prehab. That can also happen if the components are malpositioned or if somebody's spine is very stiff, then the hip has to do more work. With regards to a knee replacement, the complication that we commonly see is stiffness.
Okay.
Predisposing factors would be if somebody had a stiff knee before, they're more predisposed to stiffness. If they don't attend physical therapy, they're also more predisposed to stiffness.
And we used to see, having been a physical therapist for a while, with the different approaches that Dr. Yalamanchili talked about, we used to see more risk for dislocation with the approaches that were more common years ago. It definitely is less of a risk now with the approaches that they take than it used to be. It used to be something that we really not worried about, but we're very, very strict, but with different approaches that risk has decreased, which has been wonderful.
Sure. So going back to that, yes, with the posterior approach, there's a high risk of dislocation during the first 6 weeks. With the true anterior approach, the recovery is also a little bit faster because we're not cutting through as much muscle. The dislocation risk is also a little bit lower, so that's helpful.
Great. And then, so, before we close up today, I just want to ask, what resources are available in Harford County for someone looking for more information about a joint replacement?
So you can refer to our website, umuch.org/ortho, to find out information, and we have all kinds of resources there that people can look into.
Great. And the community will be able to work with two amazing people here today.
Thank you.
Thank you, Ronnie.
You're welcome. Great. Well, that's all the time we have for today. I'd like to thank my guests on today's show, Dr. Yalamanchili and Christina Pedini. If you would like more information on joint replacements, please refer to the resources page after this show. And join us next time for another important health issue that matter the most to the citizens of Harford County. Thank you for watching.
You've been watching Public Health Matters, brought to you by Harford TV. Watch what matters.